All right, so when I was starting my senior seminar, I was brainstorming ideas and walked into a conversation that my parents were having. I was really shocked at what I heard, and it was truly eye-opening. I never thought about not having basic care items to take care of myself, like a toothbrush or toothpaste or body wash. I have always taken pride in my appearance and most importantly my health, and I established a hygiene routine at a very young age. I soon learned this is not the case for many children, not only in our world, but here in our own community. After that, I realized what I wanted my project to be. No child should have to suffer because they lack basic care items that make themselves look and feel their best. I decided to create hygiene kits, which I called wellness care packages, that included basic care items. In today's world, with COVID being such a prevalent and unfortunate issue, our health is more important now than ever before. Once I began my project, I created an essential question that would guide my project in research. My essential question started off as, how can I show care and empathy to those in my community, and how does having and not having access to personal hygiene tools affect one's mental and overall health? I realized this is a pretty big question, so I created subcategories from this question that I felt fit under the scope of my big essential question. I started to look at things like impoverished towns, donations to impoverished towns and cities, mental health linked to hygiene, the importance of establishing a routine in young children, how proper self-care boosts self-esteem and confidence, and how lower-income families struggle to access healthcare necessities. These are all such big questions, but I felt necessary to look at each one of them and create an inspirational and informative project that will give back to my community. So a big part of my research in this project was looking at people's access to healthcare or lack thereof due to a lower socioeconomic standing. The status can be determined by a family's income level, educational level, and occupational status. Researchers agree that there is a clear and established link between poverty, socioeconomic status, and health outcomes, including increased risk for disease and premature death. More than 736 million people worldwide live in extreme poverty. They live on less than $1.90 per day, struggling to meet the cost of our most basic needs. These circumstances increase the health risks to low-income people, and with low income comes less access to care, inadequate access to food and housing, and financial stress. As I began working on my community connections aspect of my project, I created a list of basic care items that I felt necessary to include in my care packages. They are listed here. Then I went on to create a list of 82 companies, which I knocked down for this presentation, but I was going to reach out to every single one of them and see what they could offer me for donations. Unfortunately, I had no luck at all. On the phone, I was told that I'd have to apply for grants. And grants are reserved for bigger organizations like the Red Cross and can take up to 12 months just to process a loan, and I did not have the time for that. So I was really stuck at what to do next and where to go with my project, and I started to worry just a little bit. Moving on to my research, I then looked at the importance of hygiene routine in young children, how poor hygiene affects one's self-esteem, confidence, mental, and overall health. It is important to, when provided the correct health tools, to implement a routine, especially in children. Routines offer a way to promote health and wellness through structure and organization. In order to set a routine with a child, it is important to introduce practicing the routine, set reminders, continue daily, and use signals with children to remind them to do things like washing their hands. Routines not only set good examples, but bring more mental and physical health benefits. Without routines come stress, poor sleeping and eating habits, and poor physical condition, especially in younger children. Shown here is a personal experience written through a blog. In today's world, mental health is a problem more now than ever before, which is why I wanted to use the senior seminar platform to educate and give back to my community. After lots of research, I realized where I wanted to centralize my donations to. I chose Bow Memorial School and Dumbarton Elementary School. Children in middle school are going through lots of growing phases and puberty, and I felt that I cannot imagine these kids going through those times without these basic care items. Now, I last left off in my project at a crossroads, unable to get any supplies to create these wellness care packages. During the same time, I also began to sew masks for my family, as you can see here. At the same time, I was also sewing 40-plus masks to donate to Bow Memorial School and Dumbarton Elementary School, and each had inspirational quotes inside, as well as like size tags and various fabric options. I began buying all these fun, vibrant fabrics and making masks for my family, and I realized I needed another way to get these supplies and funding for my care packages. So I decided to sell masks, and I opened an Instagram page at Masks by Olivia, and thanks to so many generous friends and family, we've raised over $300 and counting, which is awesome. I've been sewing day and night, and I really love doing it to make sure that everyone gets their masks. From here, I carefully curated or edited that long list of items that I wanted to include in my care packages. I searched the internet for hours, carefully pricing everything out, and I realized that I was in a pretty good spot and thankfully overcame the one big issue in my project. There are 5 dimensions of access to healthcare. They are affordability, availability, accessibility, accommodation, and acceptability. Healthcare access, although necessary, is really expensive. Patients who are underprivileged are likely to avoid care due to the extreme cost and lack of insurance coverage. There's a need to fight for change in the healthcare system and make healthcare accessible and affordable to all. No patient should avoid the emergency room or skip an annual checkup because they are afraid they can't afford it. This is why donations are imperative in any community. Many ask the question, why give? From 1981 to 2015, the world poverty rate was reduced from 44.3% to 9.6% due to donations alone. Providing support and showing aid, showing care and empathy to those in your community is truly essential and goes a long way. No donation is too small. The knowledge that you're helping others is hugely empowering, and in return can make you feel happier and more fulfilled. Reducing poverty and providing aid to your community in the long run helps many families and children in need. Through effective charities, we can save lives, reduce suffering, and improve well-being. It is up to us to seize these opportunities and make the most of our chances to do good. A few days after I made the long list of prices, and I went to places like Target and Dollar Tree and ordered a couple things off Amazon and collected all my supplies. Once everything came in, I put together the bags, and from here I emailed the Bow Middle School nurse and the Dunbarton Elementary School nurses. There will be these bags will be anonymous donations, and I actually dropped off the VMS bags and masks this morning. From there, the nurses will distribute the bags to kids in need, or kids can come in and grab a bag and some masks. In my not too distant future, I'd like to pursue a career in the healthcare field like my dad, who's right there. I have learned from this project that I love to educate people and provide care, which are fundamentals of any healthcare career, and something I look forward to doing. This project is just the beginning. I plan to continue providing and caring for others in my community throughout my life. This project highlights that you don't have to go far to help others. There are kids in need right here in our own community. It is my hope that these wellness care packages will help me give back to the youth of my community and make change in the lack of access to healthcare and healthcare products for low-income families, especially children. Not having these basic items can severely affect a child's mental and overall health. It is important to administer products to provide aid, show care and empathy, boost self-esteem, confidence, build routine, and improve overall health to those in our community. Thank you.